Dear friends, in this video you will learn about a pap test. A pap test or pap smear is a screening test used to check for cervical cancer. In this test, cells are collected from the cervix to determine whether they are normal, abnormal or potentially cancerous. Besides, it can also help in detecting certain infections and inflammation. What happens during a pap test? In this test, you will lie on an exam table. The doctor gently inserts a speculum to see your cervix, then uses a small brush to collect a few cells. It may seem a little unusual, but it is very fast and usually takes less than a minute. That's all. Your doctor will send the sample to a lab and tell you the results. When to start a pap test and how often to do it. In the US, most guidelines recommend starting pap test at age 21. Ages 21 to 29 every 3 years. Ages 30 to 65 every 3 to 5 years depending on whether it's combined with HPV testing. 65 and older, you might not need pap test anymore. Talk to your doctor because these recommendations can vary and are based on your health history. What do results mean? Normal result. If the results of a pap test are normal, it means there are no abnormal cell changes and you may not need a pap test for 3 years. Abnormal result. If the results of a pap test are abnormal, this doesn't mean you have cancer. It simply means some cell changes were found. Besides, your doctor may recommend a colonoscopy and biopsy. If serious precancerous cells are found, the doctor may recommend a loop electrosurgical excision procedure, LEEP. In this procedure, your doctor uses a thin-heated wire loop to remove the abnormal cells. Do I need a pap test if I am not sexually active? Yes, even if you are not currently sexually active or have never been, pap tests are still recommended starting at age 21. That's because cervical cell changes can occur due to factors other than sexual activity. Now we will discuss the side effects of pap test. Pap test is usually safe and easy. Most people feel little to no pain. After the test, you might have light spotting or a little bleeding, mild cramping, slight discomfort for a short period. These side effects are normal and go away quickly. But call your doctor if you have heavy bleeding, severe pain, and fever. That's all. Thanks for watching and take care of your health.